All right, episode 22. Here we are. We're killing it, right? 22 episodes.
Pretty good.
All right, so anyway, we have a great guest today.
Who's our guest?
He's sitting right there. Dave Martinez. I mean, we also have Chris here, who's always a great guest, but he's part of the team.
Chris.
But Dave Martinez and I met 31 years ago, right? And the way we met is because Dave had two counterparts who were Mormon missionaries who came to my house. And, you know, my philosophy is, hey, you want to preach your religion? Come on in. So they came in and they preached their religion a bit, and they weren't making enough headway, so they sent in reinforcements.
Wait, I'm sorry. I'm going to interrupt.
Yeah.
You knocked on the door?
He did not. No. He was the reinforcements.
Okay, but you didn't know each other until there was a knock on your door.
Well, the knock on the door came from two younger missionaries.
Okay, got it.
Dave was the reinforcements.
Got
and
it.
it was Elder Dimmick and Elder something like Carl something.
Given. Elder
Dimmick
Given.
and Given.
I
right?
had forgotten those names until
Right.
you just mentioned it.
This was 31 years ago. Then for like a month, or no, months, like once a month, I'd buy pizza and something to drink that was non-alcoholic, right? Because he's Mormon, so we got Coke or Pepsi. And we debate about religion for like 2 hours. And then eventually Elder Dimmick and Elder Given disappeared, but Dave stayed in my life. We've been together ever since.
I love that story.
Great, right?
It's a great story.
So anyway, but he's not here to talk about his Mormon religion because we're not getting into that today. He's wearing that uniform because Dave is a police officer. Just kidding.
Yeah.
He looks like one, right?
But I thought, I was going to let you go. I was like, where's he going with it?
No. No, he's a paramedic. An EMT. No, a paramedic. What are you, Dave? New York State paramedic, right? Yeah, because the paramedic is more than the EMT.
So to be clear, everyone's an EMT.
Okay.
Then there's different levels.
Me, I'm an EMT?
No.
Okay.
Everyone in EMS, well, not everyone, almost everyone. Everyone who's a provider is an EMT.
Okay.
And then there are three different levels of EMT. There's the EMT, or the EMT basic, which some people call it.
That's the emergency medical technician.
Yes. Okay. Then there's the advanced EMT.
Okay.
And then there's the paramedic.
Okay. So.
And there's actually one more level, which is the paramedic critical care. Those are specialty paramedics.
Okay. Are you that?
I have had the certification, but there's really no use for it here in Western New York.
Okay, so you're a regular paramedic.
Yes.
I mean, paramedics are still the top of the line.
Yes.
Right?
Yes.
But you're a regular top of the line guy.
Highest level of care outside of the hospital, yes.
Right. Now, but you're not just a paramedic, Dave.
No,
You're also a mathematician.
Indeed.
You have like an advanced degree, which is
I mean, I've done master's degree studies, but I haven't completed the degree.
okay, but you're really good at math.
Yes, I am.
And you're the smartest guy I know.
Well, I can't speak to that.
Well, he is.
He must know of very few people.
Oh, I've been told that many times.
Yeah, over the years, way before
yeah.
she met you, I always used to say my friend Dave's the smartest guy I know.
Yep.
Oh, my
So whenever
gosh.
I have like smart, hard problems, I call Dave. Now I just go to Google Gemini, which is smarter than Dave somehow. No, let's not get into that now, okay?
No,
But
not.
we do want to talk about the paramedic, the life of a paramedic.
Sure.
Because there are things that a paramedic does every day, and nobody even knows what that is.
You're right. Not even doctors know.
Yeah. So give us start giving us an overview of what you do. Give us like a day in the life of Dave Martinez. And by the way, an exciting day, okay? Don't give us the boring day in the life of Dave Martinez.
I'll tell you a
Give
day
us
off,
an
a single day out.
Yeah, right. Give us a typical exciting day in the life of Dave Martinez. When do you get started?
Anywhere from 4 a.m. to 6 a.m., depending on the day. Like tomorrow, I'll be starting at 4 a.m.
Okay, that means you got to get up at like 3 a.m.
Yep.
Right.
No,
Then
2:30 usually, but
Then you got to be at your vehicle.
we got to be ready to run. We got to ready to hit the ground running at 0400.
Okay, excellent. So what happens then?
So usually we have to do inspect the truck. We make sure we have all of our equipment. I mean, over time, you get to learn the equipment. You have it memorized, so I can very quickly take a look and make sure that I have all my equipment. It's like a pre-flight check for an airplane. But I have to be ready to take any call, whether it's a childbirth or a gunshot wound. I got to be able to do anything. So we got to make sure all the proper equipment is there. So once we do that pre-service check, make sure everything's where it's supposed to be. We insult each other a few times, bust each other's chops, and then we call in service. We call dispatch.
Wait. When you say we, how many people ride in one truck?
I'm sorry, I didn't clarify. So there's usually two.
Okay.
like a Jedi, a master and an apprentice. But
There you go. Is that
except
how it really works? Usually there's
it's
a
usually
more
a
advanced and a
paramedic.
less
There's
advanced.
usually a paramedic and a non-paramedic.
A paramedic and either an advanced EMT or an EMT.
Yes.
Okay.
Yes.
And how many trucks are there in the crew that are dealing with your town? Are there like 6 trucks or 8 trucks, or is it just one
It depends.
truck?
Like in Amherst,
That's okay.
we have 15. In Buffalo, there's anywhere from 12 to 20.
Okay, but they're all going
and
at the
they're-
same time.
Yep.
So there's calls that are coming in, and all of a sudden you're in service. So they might say, the Martinez car, you're on.
Right.
And do they,
So
you get a call.
Usually the dispatcher will answer, be very grumpy, and you say good morning, hoping that he'll say good morning back, but they never do. But the one time that they do, you're like, yes, he
Yeah.
said good morning.
Wait, but they call you or you call
No,
them?
we call them.
To say you're
So
in
when
service.
we're ready, yeah, right, because we don't know what we walked into. The truck could have been a mess. There could have
Gotcha,
been the night crew responded to a fire and they still haven't fixed the truck up or whatever.
Right.
And so once we set up the truck, we call in dispatch and say good morning, truck number
Whatever. in
892 in service.
service. Okay.
And they say
Do they usually have a call for you right away?
hit or miss.
Okay.
Never know.
If
You-
they don't have a
you
call
never-
for you, do
it's
you
like-
start rolling anyway? Like, do you start getting out onto the street?
So what you do is in the city you strategically post in certain spots, and what they do is they do a linear regression analysis to see what the probability is. Like if you did a Poisson distribution in mathematics, you can say in the next 5 minutes what's the likelihood of that I'm going to get a 911 call in this part of the city, or in the next 30 minutes what are the probabilities. So based on all those probabilities, there's a rather complex model that they use where they determine the likelihood is we're going to post an ambulance here, 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 and here. There's places.
Was that figured out by Charlie Epps?
No, it wasn't figured out by Charlie Epps, but I'm sure Charlie would have been able to figure it out on his own.
Okay, so do you know who Charlie Epps is?
No.
What was the TV show?
Numbers.
Numbers.
Oh,
yes, remember
yes,
that?
yes.
So Charlie Epps would have figured that out for you.
Yes,
if
he
was
would
on
have.
your
Yes,
team.
he would have.
Okay.
Actually, Charlie Epps would have been able to figure out where the ambulance came from.
Yes, yes. So anyway, so you're spread out.
Spread
so
out.
You're all working as
so
a team.
the
though.
idea is you want between 6 to 8 minutes, any 911 call should have somebody at the door. So you fall down the stairs, call 911. Within 6 to 8 minutes, somebody should be there.
So right now, at this moment in time, there are people spread out waiting for their call.
Yes.
Okay.
Just parked somewhere.
Yep.
Okay. So, and you don't go to a call that's not near you because then you won't be available when there is one that's near you.
You go where dispatch. You do.
Yeah.
You do what the voices tell you.
Right.
So,
okay.
so
Yeah.
when people say, "What do I do all day?" I do what the voices tell me.
Okay.
That's all I do.
Right. Okay. So Brandy gives you some comfort knowing that if there's ever trouble,
6 to 8 minutes away.
there's somebody at a truck nearby.
Let me rephrase that. In the major towns, out here we're kind of in the middle of nowhere. It might take a few more minutes.
Oh, because there's nobody strategic. I never see any paramedic trucks outside of my driveway.
Something that's very interesting, and I mean this in the best possible way, but what statistics show is that the lower socioeconomic groups versus the higher socioeconomic groups, the lower socioeconomic groups are more likely to call an ambulance than the higher socioeconomic groups. So you get when you're in the city, you're driving all day long. You're going mad
Oh,
all
wait,
day.
so you go in the city
the
and the suburbs.
The farther away you go from the cities,
it's
the less likely it is. Now, I'm not saying nobody ever calls an ambulance. People fall from ladders. People get hurt. People have heart attacks. But you're more likely to respond to ambulance calls in a more populated area.
okay now. But do you? But okay, so let me see. Can you give us a day in the life of an action?
Sure.
Like when you're in a place where there's action. Like I don't want to hear the day when you're out in Clarence.
But
okay?
sometimes in Clarence there is it is an insane day. Sometimes out in Alden or
Give
Akron,
us
or,
like a normal insane day.
a normal insane day. So one of the craziest days. There's the calls we take can range anywhere from trauma to medical, right?
Now, what does that mean, though? Does that mean trauma? Somebody got hit with something or fell?
You fell off a ladder. You
Fell down the
got in a
stairs.
car wreck. You were assaulted. You were attacked with a machete. Yes, I've been on that call.
Okay, but those are
I want to hear
trauma.
about that one.
Yeah, exactly. We're getting to that one. But those are trauma, and then there's medical, like heart attack.
I'm having an asthma attack. I'm having I
stung by a
can't
bee.
breathe. I got stung by a bee and now my throat is closing. So there's medical versus trauma.
So you truly have to be ready for anything that's happening.
Yes.
And now one thing you've told me is that paramedics are the best at keeping people alive for
20 minutes.
20 minutes, right?
Yes, indeed.
So in fact, even if you had a doctor on site, and if the
so
doctor could help you, what's the best way to help?
I need to address that right now.
Okay.
If you have a doctor on site right now,
Yeah.
go and get a paramedic. Okay?
For the first
Because
20
I'll
minutes.
tell you what a doctor's really good at. So how long have you had this pain? Let me write you a prescription. Unless that doctor's been a paramedic or is an emergency medicine
What about
doctor.
emergency room, like my cousin Tony?
Well,
He's an
that's,
emergency room
if they're an emergency medicine physician,
Yeah.
then they might have the same skill set. A lot of emergency medicine physicians either are or were paramedics, and they understand what it's different. Your classic run-of-the-mill internist, your run-of-the-mill orthopedist, your run-of-the-mill eyes,
Pediatrician.
nose, and throats, your pediatrician.
No, but you told
If
me
they're
once
not
that if a doc-
specialized in emergency medicine, they're not the ones you want right there.
Well, you told me once that if somebody said to you, or a nurse said to you, "How can I help?" You'd say, "Go sit in your car," right? Because it's not their area of expertise.
Yes, and
right?
that has actually happened. Or if a physician shows up, "Hey, I'm Dr. McGillicuddy." If he is not an emergency physician that I recognize, I'm going to tell him to go sit on the truck. But if he comes as a physician and tries to outrank me and says, "Hey, I want to take this patient," I would then call my physician, my medical control physician, and say, "Hey, I have a physician on scene." And then I let them talk doctor to doctor, and they can sort it out.
But while the person's dying.
Well, I'm doing my thing.
Okay, you're
They
working.
can talk while they're working out. Then when they're done, I'm going to talk to my doctor. And if he says, "Tell the guy to go pound salt," I'm going to wrestle him to the ground. If he says, no, let him take over, then he can take over. But if a physician takes over, he is responsible for everything. That means I stand back and put my hands in my pockets.
Right, all the equipment, all the people, they
You
back
can
off.
use my equipment,
Okay.
but this is what I'm doing. And my hands are in my pockets.
Right.
Because because that physician wants to take over.
So
No physician in the right mind would do that.
If they knew what you did, what were you going to ask?
So I'm a lifeguard certified.
She is.
But
She's
one
good
of the things
too.
you learn in your lifeguarding course is to only provide service until somebody more advanced. So an EMT or a paramedic is more advanced than a doctor at keeping people alive for the first 20 minutes.
Again, if it's an emergency medicine doctor
Okay.
and they have their tools, they trump everyone.
Right, but they
Got
got to have their tools.
Yes,
Got
yes.
it.
So we
So
have
really an ER doc would be really valuable in that first 20 minutes.
maybe.
Okay.
It depends because if they're trained as a paramedic, because we do very specific things to stabilize somebody immediately. A doctor is great, and I love the doctors I work for, and don't misunderstand this, but a doctor is great is saying, you do this, you do that, you do this. The doctor is not generally great at actually doing it.
Right.
Right? I'm the guy who gets
Unless
his
they're
hands
an
dirty.
ER doc.
Unless they're an ER doc.
Like Tone, my cousin Tone, who swims with us, he says he does those intubations all day long, and he's actually doing hands-on stuff.
Yeah.
And people are getting
And
wheeled in with a paramedic.
With a paramedic,
Right?
yeah.
Yeah.
But as I'm saying, if they're an emergency physician,
Right,
medicine
it's a different
physician,
situation.
then they have all the skills that we have and more. If this is the skill set of an EMT, then I'm going to say this is the skill set of a paramedic, and the whole room is the skill set of a doctor.
Right,
Okay,
right.
so
Right, but-
I'm not in any way trying to say.
No, but there's the Venn diagram thing, right?
Yes.
Right? So
Yes.
that's probably relevant here.
But I'll tell you, sometimes when we have some of the doctors do ride-alongs with us, and sometimes for the ones who were never paramedics, sometimes it's very eye-opening for them. Because we go for I'm having trouble breathing, or the chest pain, and the patient is between the toilet and the tub. Now we have to get there. We have to get them out. We have to assess them. We have to stabilize them. We have to get them out of the house into the ambulance. Do whatever we have to do to stabilize them while we get to the emergency room. And a lot of times when doctors see that, they're like, "Oh my gosh, I had no idea."
Yeah.
Because usually when a doctor sees a patient, in any clinical setting, the patient is ready to be examined. either the nurse has already prepped the patient or the EMTs have already prepped the patient, stabilized the patient. All the doctor has to do is come in and say, so, how long have you had that pain? So it's
But do you have to, when you go onto a site, you have to, it could be all kinds of situations.
I don't know what
it
I'm
could be
gonna
very
find.
physical, though.
Yes.
Right? Because if they're stuck in a well.
Yep.
I mean, wherever
Then I
they
get
are.
Benji.
What's that?
Then I get Benji or Lassie.
Okay, yeah, right. But the point is, like you said, I mean, if there was a collapse of a roof and somebody's trapped under a roof, I assume you have the fire department there too, right?
On the 90 today, there was an
Yes,
accident.
the
A
bus
semi
flipped
truck
over.
hit a bus,
And I guess it flew in the air and flipped over and slid on its back.
and there were over 30 patients. There were some fatalities. One of the paramedics who responded I happened to be communicating with that person, and they were like, "Oh my gosh, here's what's going on." So I was like, "Ooh." And I understand because I've been the paramedic on those scenes before, what that person was going through. So one of the doctors who was with one of the local fire departments was on scene.
This is like an ER doc.
He's an ER doc. He's a med control physician. He's a medical director. Everybody knows who he is. So once he gets on scene, everybody knows he's the boss.
Okay.
But what the doctors who are properly trained in emergency medicine know is it's not about their ego. So very few times will they be like, I'm the doctor and here's what you're going to do. They know who their paramedics are and they know what their paramedic capabilities are. And sometimes they just kind of stand back and let the medics do their thing because they're not active paramedics and they know that. And it's even if they were a medic 10 years ago, they understand, well, it's been 10 years. I'm not in the field right now. And any good physician isn't going to tell the nurse what to do and how to do it. The physician might say, I need you to administer this medication, and then not worry that it's going to get done. But very seldom will you see a proper physician say, hey, do this. It's the ones who don't really know what they're doing, the Dunning-Kruger effect, who will step in and say, oh, no, you should do this or that. Or sometimes they'll say it's a life-threatening emergency. And to illustrate that, years ago, I wasn't the medic on this particular call. There was at the convention center in Buffalo, there was a group of physicians at some kind of convention, and one of them keeled over with a cardiac event. And the doctors became a room full of chaos. Everyone's barking orders. Everyone didn't know what to do. When the paramedic rolled in, one of the docs was an ER doc and recognized the medic, and he said, "Oh, thank heavens, somebody who knows what they're doing."
Wow.
And
that guy knows what the paramedics can do, whereas the others, they're regular docs.
But the other thing too is, am I a paramedic if I don't have my tools? And that's the question. Now I say no. If I don't have my tools, I'm not a paramedic. I'm just a guy.
With CPR training.
With CPR training, yes.
Right?
But it depends on the scenario. When I have my truck, when I have my ambulance, I can handle anything. Again, from a machete attack to a childbirth.
Right.
So
let's go back to that bus example. You got 30 or so people on the bus. Were these children or adults? Was it a school bus or?
it was a touring bus.
Oh,
so there
these
were
are adults.
Yes. There were children too.
Okay,
unfortunately.
but it's upside down, right?
I wasn't on scene, so I don't know if it was on its side or upside
I know.
down.
I just
don't know.
heard I heard it on the news when I was coming.
Usually when
let's
it's
say either way.
Usually
either
when
on
it's flipped on its side.
Okay,
not,
so let's
not,
say it's flipped on its side though. You got to get in there.
Yep.
Right? And how many paramedics would be on that scene?
Well, the fire department would handle that.
Oh, they would. Okay.
So there's a very
who gets the people
there's
out?
a very close marriage between fire, EMTs, and police.
Okay, but the fire, are they trained pretty well for EMT type work?
Well, a lot of agencies have their firefighters are also EMTs.
Okay.
Some agencies, they're certified first responders. But we have locally, we have excellent chiefs. We have excellent departments, a lot of training. A lot of the volunteer firefighters work for a paid agency.
So when you get on the site of that bus flipped to its side, right? Who gets there first typically? Is it
typically the fire department?
Fire department. Okay, so they show up and they take action right away.
Yes.
Okay, so they're, like you said, first responders, sometimes EMTs, sometimes more. Maybe one might be a paramedic.
Yeah.
So they get in there and they know how to move people. And by the time you get there, which is probably right after, you said 6 to 8 minutes, right?
So equipment, Anything dangerous, fire's going to do it.
Okay.
If something is on fire, the fire department's going to run in.
Right.
If something could be on fire, the fire department's going to run in.
Right.
If something is dangerous and unstable, the fire department's going to run in. They're insane.
But they're also trained for that.
They're trained for that. They are. And I mean, truly, they're heroic and things like that. And I'm not trying to be trite or anything, because and we always bust their chops and you know. But they do heroic things. They really do. And they're trained very well. And these are men and women who are dedicated to what they do. And I have nothing but respect for them.
But when you go into a site, though, you've got to start using your intuition. And how many years have you been doing this for? At least 10,
I
right?
first became an EMT in 1988.
Okay,
I think
so more
it
than
was.
10.
Maybe 87.
Okay,
yeah.
so let's see, 98.
So I've
08,
been
18,
on and off, but I've been
35
doing
years.
it for 30 some odd
37,
years.
38
Yeah,
years.
yeah.
So you must have built up some intuition. When you see something at a site, you see different things than I would see,
Yeah,
right?
absolutely.
Just from seeing a zillion, your neural net is training on
Yep.
all this stuff, right?
Yep.
I got to hear of a situation. I know there's a situation we've talked about, and you know we're going to talk about this, right? The dead baby story.
Oh gosh, look, I happen to have told you about that, but I want you to understand something. It's like when I see war veterans who just don't talk about it, there's a reason they don't talk about it.
Okay, but this is about your intuition, though.
I'm willing to
Okay,
tell you that
yeah, yeah.
story. But I do want to say this because people have asked every time you're a paramedic. The first thing they ask is, "What's the worst thing you've ever seen?"
Well, this though is not the worst.
This
thing
is
you've
not
ever
the worst
seen.
thing you've ever
But
seen.
by the way, let's put this into context. Why this came up? We were talking about the book Blink by Malcolm Gladwell.
Yes.
Right.
Yes.
And I was saying how in that book there was a story about a statue, a very ancient statue that was dug up and on display at a museum, and the people were about to buy it for like $20 or $40 million, right? And they hired these experts to come in and analyze it, and all the numbers worked, but the experts didn't think it was real. Even though the numbers worked, they did all the testing and it worked. And the one said, I felt a feeling of revulsion when I saw it. One guy said, it didn't seem right that a statue that was underground for all these years could look that good. There was something inside them, a hunch they had, which was really a hunch is subconscious processing of information that you just can't put your finger on why you believe that, right? Mm-hmm. So I'm telling you this story, and you then told me this story in response. I've probably told this story a dozen times since then because it goes to show the value of experience.
Yes.
Right?
Yes.
Because most people nobody would have seen this.
No, nobody. Well,
Hardly anybody.
other paramedics.
Yeah, right.
Likely
yeah,
would
but
have.
regular people wouldn't have seen what you saw.
Not in general. No.
So we need to know what you saw.
So, the call went out for, and I don't remember if it was a child with difficulty breathing or maybe even a child cardiac arrest. I don't know what it was. I get on location. The fire department was already there. There were a lot of firefighters were on scene, and I get there and people are somber and they're like they're inside, and I'm like, uh-oh. I walk in and I was frustrated, I'll be honest. I walk in and the firefighters just kind of parted ways, kind of like Moses parting the sea. They just parted to the side. And then I don't know who said it, but I heard somebody say, could have been a police officer, could have been a firefighter, I don't know. It's going to be okay, ma'am. The paramedic is here. And I no, do not say that because if the child was very limp in the mother's arms, and it was so when I walked in, my first view was like, oh great, a dead baby, and then I heard that, and I'm like, do not give false hope to anybody. That's something I will never do. I'm very blunt with people, and I'm straight up. I don't say you're gonna feel some pressure. I say this is gonna hurt.
Right.
So,
right. Yeah.
so
I like that.
You know, and so I just walk. What am I gonna do? So I walk in. And the mom looked defeated. She's holding the baby, and she hands it to me. She just reaches out, and I just instinctively take the baby. And the only thing I thought was, good, she just gave me a dead baby. Okay, so I turn around, and as I'm turning around and walking out, I'm looking at the child, and I'm saying, I don't think this baby's dead. So at that point, because the fire department, and this is the mistake I made, because the fire department had already been there, and they already did their assessment, and nobody was calling a cardiac arrest.
Right.
And the baby did look
Deadish.
discolored. Yes,
Yeah.
yes. So I could see how someone might think that. I made the mistake of thinking, well, everybody did the assessment. Everybody knows the baby is not breathing, and I'm just going to take the child and go. And then I'm like, oh, no.
But yeah, so that's in your head when you're going in. All these
So
people
once
have
I
already
took a
looked,
good
you
look-
assume they've looked
Right.
at it. These are professionals.
Right.
Right.
So when I looked at the baby, that's when immediately it stuck in my brain like this child's not dead. And then at that point, I ran out to my truck. Because outside of my truck, I don't have my tools. On my truck, I have my tools.
Right,
Now
yes.
we carry in bags that have all of our. We have a house bag and a drug bag, and that has all the equipment we need. But on my ambulance, I got everything I need.
Right.
So I then ran onto the ambulance, and I closed all the doors. So I now know what I'm gonna do. So first thing I do is I'm gonna auscultate the baby's chest. Do I hear a heartbeat? I wasn't sure if I did. I wasn't sure if I didn't. I don't know. Maybe. Should I do CPR? Yes, I should do CPR.
Wait, before you go on, would somebody who was that, I mean, you're a paramedic and something gave you the impression that this baby's not dead.
Mm-hmm.
But if you hadn't had that impression, would you have still done that?
I can't answer that.
Okay.
I don't know.
But you did believe this baby might not be dead.
Correct.
Okay. You didn't know why.
Now-
So then you started your
Now,
test.
I want you to understand, right now, today, I would have handled the call differently. Right now, today, as soon as mom gave me the dead baby, I would have started CPR immediately without even thinking.
Oh, even if you didn't have that hunch.
Right. Right. Years ago, and this happened a long time ago.
Yeah.
Years ago, it was always airway. You get the airway first. You get the airway first, then you worry about CPR. Airway, airway, airway. Everything is airway. Whereas today, it's CPR, CPR, CPR. You do CPR first. Circulation first, then worry about the airway. Because if I have an open airway and I'm breathing for you, what does it matter if your heart's not beating? Right? If your heart's not beating, it doesn't really matter.
Right.
But back then, we didn't know that. So that's why I took the steps that I took back then, which I would do differently today. But so the first thing I was going to do was establish an airway. And when I opened the airway, I used a tool called a laryngoscope, and I did what's called direct laryngoscopy, where I put the scope into the airway to kind of so I could see the vocal cords. I did a maneuver that I wouldn't necessarily do today, and that maneuver forced the vocal cords to open. When the vocal cords opened, fluid came out. I suctioned out the fluid, and baby started crying. So I knew.
Wow.
Now, as this is happening, before the baby starts crying, I have my makeshift pediatric suction, and the supervisor opens the back doors.
Wait, what do you mean by makeshift?
You give me a roll of tape and a stick of butter, and I could build a ventilator
Okay, so
for
it was you made it.
Yeah,
Like
so I
MacGyver.
had, yeah, you have
Yeah,
to be.
right?
You have to be.
Right,
So,
you made this device.
I used suction equipment, but I modified it for the particular
Okay,
patient.
yeah.
And
Wait, at that moment?
at that moment,
You made shift at that
right
moment.
there, yep.
Wow.
So supervisor opens the doors. He looks at me and he said, "Oh boy," and he closes the doors. And I'm like, "Okay, well, thanks for your help." And next thing I know, the ambulance starts moving. So what the supervisor had done was saw that I had a baby, closed the doors, went and started driving the ambulance
'cause
to the hospital.
Supervisor thought this baby might be alive.
I don't know what the
Dave's
supervisor
back
thought.
there, and if the baby's alive, we need to get to the hospital.
Right. So he starts going. So now all of this happens while we're moving. He's calling ahead. Children's Hospital has a particular team that will meet you at any hospital you're at to take the baby so that they can take him to the specialist for the neonatology or whatever. And so baby starts crying. Of course, I clear the airway. I make sure everything's good. I'm now holding the baby. Baby's all happy. And
That's
yes,
stunning.
Yes. Now, mind you, all I did was a stupid maneuver that I probably shouldn't even have done in the first place. It happened to work.
Right.
We get to the hospital, and the team from Children's Hospital is there. So we get there, we pull in, they fling the door open, and I'm holding the baby, and they're like, "Oh, we thought it was cardiac arrest." And I said, "Yep, it was." And they're like, "Well, where's the baby?" And I'm like, "This is the baby." They're like, "That's the baby?" "Yes, this is the baby." They're like, "Well, what did you do?" I'm like, "I didn't do anything." And they're not believing me. You know,
Well, you
and-
did
and
do
I did
something.
do something, yes, but
You did two things.
I didn't do any of the crazy advanced interventions.
But
I
you
didn't
did
give
two
any
things,
drugs.
though.
I didn't.
Number one, you noticed that the baby might not be dead,
That's true.
and then you did that laryngeal.
I cleared
thing.
the airway. Yep.
So how would that have played out if you would have started CPR immediately?
Nothing because
The-
the child
thing
wasn't
was-
having enough circulation. Because
Right.
what happens is you go hypoxic and then you go bradycardic, which means your rate starts slowing down. So the child was hypoxic and starting to go bradycardic. Now at the time the training was open the airway, start the breathing, and then do CPR. So I was doing it in that order. Today it would be do CPR first,
Right,
then
but-
worry about the airway.
No, but Brandy's question is, what if you had done it the way it's done today with that kid?
The baby would have the same outcome. It would have been the same outcome.
But didn't you say that something was closed and then you touched it and it opened?
Yes. Yes.
That wouldn't have happened if you were doing CPR.
Well, no, but CPR makes sure circulation is happening.
Oh, okay.
So what happens is you start going hypoxic. Children, unlike adults, they're fine until they're not. Right? Whereas an adult will gradually decline and get worse.
Wait,
a kid
so-
is fine, a kid is fine, a kid is fine,
But
a kid
once
is
you
not.
popped it though, and it opened and started, fluid came out, then it started crying. Did the heart start going on its own, or did you have to do CPR?
The heart was already going.
The heart was already going.
But you couldn't hear it.
Because
couldn't hear it.
didn't have the...
Right. It's because the child was hypoxic.
It was just going very
low-
slowly.
Because the child was low on oxygen, the heart rate started to slow down.
So as soon as it
And
got
as it
oxygen,
slows
sped up.
down, right, as it slows down, a lot of things happen. So the child was at a point where the force of the contraction was less, the rate of the contraction was less. By oxygenating, everything started to come back up again.
Right. So
So
now-
it would just be the reverse. It's like I could blow up a balloon by putting positive pressure into it, or I could put it into a vacuum and it will suck the balloon to appear full.
Right.
Same idea, one or the
So
other.
you would have started CPR and given breaths, and then would the breath have opened it, or would you still have to have used your tool?
No, I just would have done CPR until I got to my tools.
Okay. So you're saying you did
Gotcha.
nothing except bring the baby to the truck.
As soon as when I realized this baby might be alive,
you raced.
I was maybe 10 feet from my truck.
Right. Okay.
So at that point, I wasn't going to waste time
right.
playing around. I was going to get to my truck, which I got in split
And
second.
like you said, I
right?
like how you let off with that. With your truck, without your truck, you're just a guy.
Right.
You get your truck and you're Superman.
Right.
For 20 minutes.
Right. Well, see, Clark Kent is Superman whether he's in uniform or not. But Batman, I'm Batman, see?
Yeah.
See,
He
Batman,
needs his tools.
right.
He needs his tools.
He's
when
just
he gets
Bruce
out of
Wayne
bed in the morning.
When he's
just
Bruce Wayne at a
regular guy.
fundraiser,
Yeah, right.
he's just Bruce Wayne at a fundraiser. But you give him the bat suit
gadgets.
and the
the
Batmobile.
Kevlar, yeah, right.
We're on. It's on.
Right. Although I think he's probably a pretty good fighter, even when he gets out of bed in the morning with no equipment.
That's true. That's true.
'Cause he
And
did
I'm
all that stuff overseas
and I can
and-
do a lot of things
Yes,
without my
right?
equipment
'Cause
too.
you still know CPR.
And there's certain equipment that I always do have.
you got it.
So and this is necessary. So the first and most important thing that most of us have is one of these. Okay, just a simple little knife. That's going to do a lot. That's going to cut seatbelts.
Did you have that open in your pocket?
No.
Was it-
Then of course you said MacGyver. Guess what MacGyver uses,
Oh,
right?
yeah.
So we have a little Swiss Army knife. That's very important. Another thing that's very important for a paramedic is this. This is a pair of shears. I can cut through anything. This can cut through a penny.
Wow.
This has multiple things. It's a ring cutter. It's a seatbelt cutter. It's an oxygen key.
What do
So
you mean an oxygen key?
if I need to open an oxygen tank,
Oh, okay.
I can.
I thought you
Use-
meant somehow spews oxygen.
No,
from you.
I can use this to open up an oxygen tank.
Ah,
yeah.
okay.
So
That's cool.
That's cool, right? You
right.
wanna
So
get some of
that's
these tools.
something we all have. Then of course there's the advanced MacGyver, which is an actual multi-tool, right? So and this one, it's a pretty heavy one. Feel that it's a hefty one, right? It's
Ooh.
But it is
So-
more than just that little wrench there.
no, yeah. I've
Oh,
got
look at
multiple
all these
tools in here.
things.
I've got lots of tools.
That's
in
like an
here.
advanced Swiss Army knife.
Right. And then of course we use there's the thing that nowadays especially we have to wear gloves. So you got your gloves that we
Yes,
all
right.
carry around. This is another important feature.
Flashlight.
A simple flashlight, right? This is very important, especially when you go into houses, especially in the more in poverty areas. You might go in and there's no electricity.
Right,
You might go
right.
in and it's in the dark. Or you go in and the patient's saying, come over here into a dark room. And you're like, I'm not going to dark room. So I
Right.
put on this light.
Is that a good flashlight?
This is very bright, yeah. I could also blind somebody with this if I have to, if they're coming at me. Then you have your
keeps going.
then you have your typical, like this is your standard pen light to check pupils. Because if I use this to check your pupils,
Right.
I'm blinding you. So, and when I see people use their phone to check people, like, don't do that. Yeah, this is designed to look at somebody's eyes. Those
what
other
if they
ones
don't
are
have
just too
one?
bright. I mean, if you don't, then be very quick.
Okay.
There's no reason to shine a light in somebody's eyes and need it there. So then there's another
Yeah, right.
another very important tool is this. It is mightier than a sword.
You write stuff down.
You have to write stuff down. You cannot be in service in New York State without a pen.
But I'll bet you if you have a pen, you have something to
pulling
write
all
on.
these over here?
I'm also a magician, by the way.
You also have stuff to write on? Because what good is a pen if you can't write on?
Yes,
Is there
yes.
Are you going to pull a pad out?
Then there's something that's very important,
a pad.
and that's the stethoscope,
Okay.
right? So these are just minimal things. Now, we were talking earlier about self-defense. Sometimes people get very hostile and they want to attack you. So we have different ways of doing that. So one of the ways of doing that, now here I have this pen, which is a very nice pen, but it's only a pen. If I need to, I can use this pen. See, this pen is a very nice pen as well, and it writes perfectly fine, but also this pen is made out of a certain type of metal that if I were to hold this pen like this, and see that? I could break a glass with that, or I could jab somebody in the ribs and take them down.
Wow.
So, not that I'm planning to fight with anybody, but people do attack you. And if I'm being attacked, I'm going to do what I can to get away. Now, that's the only purpose for this is to bring them to the ground, and then I can flee. So I have no weapons that will, we don't carry guns or anything like that.
We're now gonna do a live demonstration with the pen.
Okay.
Yeah. No, could you let Brandy stab you in the chest?
Another sudden onset pinpoint pressure right in
No,
the chest.
actually, it'd be better if she could stab you in the eye.
And
That would really show
yeah,
us, right?
that would. Let me take my glasses off.
No,
first.
the pen part is on the inside. You got to take the cap off. There you go. That's the pen part.
Yep.
Cool.
Yep.
That's
It's called
cool,
a
right?
rebel pen.
I also have but then on my regular keys I also have an oxygen wrench, which is very
The
important.
oxygen tank.
Yep. And then I have another one that if I have to
That seems like it's more
defend
robust
myself.
than the other one.
they're both just as effective.
Oh, they are?
Yes.
Okay.
So
That one looks a lot pointier, though.
that one
That looks more stabby.
okay, yeah, that one does look more stabby. And then a few other things, but
Would you carry this stuff with you wherever you go, like to the mall?
when I walked in here I was in uniform.
Oh, as long as you're in uniform, that stuff's in your pocket.
This is in my pocket. Now this knife, by the way, it's not spring loaded or anything. It's just a plain old knife. It's just the way I opened it that made it look like it was spring loaded.
Cool.
So what of this do you
Smith &
carry
Wesson
with you when you're
Extreme
not
Ops.
in your uniform?
I don't carry any of it when I'm not in
Okay.
uniform.
None of it?
No need.
Right now, if you're okay,
I
so wait a second.
promise.
You're at Wegmans.
Tom, I think you need one of these.
I know, right? you're at Wegmans.
I mean, I have more
You're a
at home. Like
civilian.
I have ones that would really make you.
Wait, you're a civilian at
That's a
Wegmans. You
knife.
don't have your uniform. You don't have your truck.
That's annoying.
Someone falls down. They're having like an event, a cardiac event. You
Wait.
do know CPR.
Well, yes.
They
Okay.
can't breathe, or they're holding their chest. Something's happening. You're still very useful. You don't have your truck, but you're still Bruce Wayne. Because Bruce Wayne, though, he's still pretty good with just his hands.
Yes. See, now if I were Tony Stark, I'd be carrying a little suitcase that would have everything I needed.
But Bruce Wayne's better than Tony Stark because Bruce Wayne's actually a fighter guy.
That's true.
Whereas Tony Stark
Is all
purely an
technology.
equipment
Yes,
guy, right?
yes.
But you're a fighter guy, so and I don't mean fighting, but you
Yes.
could do things even without your equipment. You could do chest compressions.
I can do chest.
You could do the CPR stuff, right?
I have pockets everywhere.
It's like Mary Poppins case over there.
I
pulling out a
have,
banana.
I do have more things on me, but I'm not going to share
You got a
them. But,
lollipop?
Wait, so
but I mean, but I also have, I have my cell phone, and I have, I have other things too. I have multiple pockets within pockets, so there's a
Like
place
safety
for
pins.
everything and
Yes.
everything in its place.
All right, so Dave, a couple things though. One is, what would you recommend for like regular people? What basic training should they get? Should people get CPR training?
CPR.
And now I did CPR training years ago, and I've forgotten it all. And I've often thought I should do it like every year. Is that a thing?
Every year, well, I guess it depends on the individual, but everybody should at least have a sense of CPR. If you called 911 and they said start doing chest compressions,
Right.
you should have a sense of how to do that. Everybody should do CPR on the rescue Annie doll at least once.
Right. Okay.
I think CPR expires every 2 years.
It's 2 or 3 years. I don't. Maybe 2 years.
I think
Yeah.
it's 2 years now.
And maybe it expires every 2 because you forget it
It's probably a
after
big
2.
thing, yeah.
Okay. So
Right. So the CPR that I take is the CPR for healthcare providers. So it's slightly different, but it's almost the same.
So you'd recommend people take CPR?
Absolutely.
Okay. Any other like things that regular people should be doing in the event of a catastrophe? And I don't mean like a volcano erupts. I mean just something that normally happens to people. They cut themselves and they start bleeding like crazy, or call 911. Right?
I mean, yeah. If the bleeding can't be controlled, absolutely call 911. Do I recommend everybody? I recommend CPR for everybody. I recommend a first aid course for everybody.
Yeah. First aid. So those are different things.
Yes, those are very different things. If you get a good first aid kit from any one of the stores, it'll probably have the bare minimum that you need. Some ointment for bug bites and or cuts, some bandages, things like that. And then you could learn how to do that. But CPR is the most important one. I mean, we all know the story when Damar Hamlin was playing for the Buffalo Bills.
That was a paramedic that saved his life.
It was
right?
a paramedic who saved his life. But what he had, when your heart beats, you did lub dub. There is a millisecond. Actually, it's a few milliseconds.
By the way, Damar Hamlin plays for the Buffalo Bills. They were playing against the Cincinnati Bengals.
Yes.
During the game, something happened. He made a tackle.
So I'm about to explain what
okay.
happened.
I just want to,
So
because
lub-
people might not know who that is.
Oh, right. Fair enough.
So he's in the middle of a game. The game just started. I think the Bills just gave up the ball, and the Cincinnati Bengals offense came on, and Damar Hamlin's like a defensive back or a linebacker or
I think
something.
it was a safety. Yeah.
Something like that. And he makes a tackle, falls down, doesn't get up.
Right.
So
Right.
go from there.
So yeah, he makes the tackle. He got up, and then he dropped again.
Oh, yeah, right.
Dropped again. No pulse. Not breathing. So lub dub. What happens is, I mean, I'm not going to get into the details, the specifics, unless you want to.
No.
But electrolytes exchange. The myocytes in the heart all contract, but they contract in unison. So I got that lub and I got that dub. When the heart is so the left side of the bottom of your heart is the pump. So when that part is refilling, when it's also repolarizing, getting ready to get that signal to contract again, there is I don't remember exactly. It's maybe 20 milliseconds period, which is the incomplete period, repolarization period. It's a refractory period, but it's an incomplete repolarization. If you hit it again, right at that spot, one of two rhythms could happen. It could be a very deadly rhythm where you're dead and you need CPR, or your heart could stop altogether. And it's just, it happens every time your heart beats, but it's such a small window, and you got to get hit right in the exact spot, right
That's what
at the
you mean by get
exact
hit.
moment.
So in other words,
It's
the
called
heart's doing
commotio
this normal
cordis.
thing, but there's a moment where if you hit someone at that moment, bad things happen.
Right. Not only in that moment, but in the right spot.
Okay. Gotcha.
So the
So
odds,
you, like, won the lottery.
The odds
You won
are
the reverse
infinitesimal.
lottery,
Yeah.
right? Yeah.
What
Right.
did you say it was called?
Commotio cordis.
Okay, so that happens. He's down. His heart stopped.
His heart, I don't know what rhythm he was in.
Okay.
He was in one of two
He
rhythms.
was either in the heart
one
one
of
or
three
the,
rhythms,
the stopped
actually,
one
but-
or the deadly one.
Right.
And then-
well, the deadly one is not perfusing, so he's clinically dead, whether he's in any of the rhythms.
Right, okay.
Completely stopped, definitely. The other two possible, ventricular fibrillation or ventricular tachycardia, either one of those without a pulse, either one of those, you're dead. But
Where's the paramedic at this time? Is there one on the sidelines?
so I know what they do in Buffalo. I don't know what they did in Cincinnati, but I would imagine it's the same. So in Buffalo, one of the agencies is contracted to always be on the field. And so their ambulance is off to the side, but right on the field. They can go onto the field at any moment.
And they got their truck.
There's a team of paramedics there from our local agency. There is a team of paramedics there, and they're waiting. They're waiting for something bad to happen. And
Every game, you got a team
every
of
game,
paramedics there. Okay.
every game there are every Buffalo game, and I would imagine every game everywhere.
Right.
But I know for a fact in Buffalo, every game in Buffalo, there are Buffalo paramedics
For both teams.
for both teams.
For any player that gets
Yep.
injured.
Also, the teams have their own physicians and their own
Right.
But there are local paramedics there ready to go with all the equipment necessary.
And in that case, the paramedic was there quickly, within minutes or
Well,
moments.
you're on
right?
the sidelines. You're literally
So they're
right
running
there.
right
Yeah,
out.
Yeah.
Okay. And then they did what in that case? They did something
Well,
to get
they
his
would
heart going
they would
again.
initiate advanced cardiac life support, and there's various procedures that you would do. So it's a very systemic protocols. There are certain protocols in place that if somebody's down on the ground, what do I do? And then they would begin their immediate assessment.
Okay.
And he got immediate CPR.
So what do you love about your job? If anything.
I mean, I love being a paramedic, right?
Superhero.
I hate.
Right.
No. But that's not why I do it. I don't do it
No.
because I'm thinking.
No.
of,
You're saying why you love it, and she's saying who you are.
Oh.
Okay?
No.
You're a superhero,
I'm,
but you're not.
I'm
you're not
just
doing
a
it
guy
because
doing
you're
a job
superhero. with
but-
tools, with really good
with
tools,
with really good
right?
tools. Yeah, and some good people.
But what do you love about it?
I love being able to. I think this will illustrate it. So one time years ago, there was a little girl in West Seneca, and she little girl, blonde hair, blue eyes, blue dress, looked like a doll. She was, I don't know how old she was. I think she was 3 or 4. And she's in the doctor's office, and I walk in and I see her, and she's in distress, and she had asthma. And the doctor says, we've given her 3 breathing treatments and nothing has happened.
But somebody called the paramedic.
The doctor
came in
the
on
doctor
your
then
job.
called
Okay.
the paramedic.
Okay.
Yeah, this baby needs to go to a hospital.
Yeah.
So I get there and I assess my patient. And most doctors understand, especially those, once the paramedic is there, they back off. They'll give you a report, but they're not telling you what to do or anything. They back off, and they understand that. Now, sometimes we'll talk to them as colleagues, and they will give us advice or ideas or what have you. Sometimes they'll just step back and let you do your thing. I like to build a good rapport with the physicians that I interact with because we're all on the same team. But anyway, so I get there, and we get the girl on the stretcher. I call the doctor at Children's, and I discuss what I would like to do, and because she's already had 3 treatments. So I don't want to give her too much medication on anything, but I also know how she's presenting, and I also know what my instinct tells me. Like, I know what I need to do, but I wanted expert consultation, and we have those numbers in our phones. We can call the doctors at any time and say, hey, here's what I got. Let's talk about this. So I call the doctor, and we agree on a treatment plan, and I start that treatment plan. By the time we get to Children's Hospital, this little girl who couldn't even gasp one sentence is breathing and talking and happy,
Wow.
and she says to me, I like pizza. Okay? I felt like Superman. I felt like that was the greatest. If I never again help somebody, that one was enough to take me to retirement. That's why I love the job. To see that little girl suffering to the point where she's smiling at me and telling me she
Right.
likes pizza.
Oh,
Yeah.
that's awesome.
That's why I'm a
Okay, so
paramedic.
why do you hate the job?
Long shifts. Long shifts.
What's a long shift?
Well, so our shifts are 12 hours. Now, you could be held over for up to 14 hours. So you can get a phone call that says, hey, we're short trucks. We need you to stay in service. So now your 12-hour day is a 14-hour day. But I can be held over. But if, let's say, at 13 hours and 55 minutes, before my 2 hours are up, there's a pedestrian struck right across the street. Guess what? I now have to take that call. And depending on where I am and how bad it is, that could be up to 16 hours I could be on a truck. And the next day, I got to come back and do it again.
Right.
Why
So-
is that? Why are the shifts as long as they are with a job like you're doing?
That's a legacy thing.
How many days
It's
a week,
always-
though?
It depends. Some places do 4 days on, 4 days off, 4 days on, 4 days off. Other places, so that's a dynamic shift. Other places do a static shift, which is you can work 4 shifts in a week, but you pick the days you work. Some places have both static and dynamic shifts.
But it's a long day.
It's a long day.
Yeah,
It's a
so
long
it's
day.
tiring.
And you could be on mandatory overtime. There's also mandatory overtime. And there's no limit as to how much mandatory overtime you could be forced to do. New York State has no limit. There's no legal limit.
So it's a tiring, long job.
So
at times.
you've just worked 4 days, 12-hour shifts, but every single day you were held over or got out late. And on your 5th day, they could say, Tom, you need to come in and work a shift again because we're short people. We need you to come in. You're mandated. And all you can do is say, thank you, sir. May I have another?
Yeah.
I mean, it's usually not what happens. Usually they're like, you son of a mother, son of a... Okay, I'll be there in 10 minutes.
Yeah. But it seems to me that for you at least, you're still doing it, right?
Yes.
So the good must outweigh the bad.
The good does outweigh the bad. I mean, it's a grueling job. You know, the job comes with, 3 divorces in most cases. It comes with alcoholism. It comes with PTSD. It comes with a lot of people have, the 3 divorces.
Wait. Do you mean the job, being on the job, often yields
There are
divorces,
a lot of people,
alcoholism,
yes.
PTSD?
The divorce is the joke. Like, someone says, I want to go to Paramedic. And they're like, son, you haven't had 3 divorces yet. Or, how many divorces are you at? Oh, you're at 2? Okay, all right, you do for 1 more? You can be a paramedic.
Wait. No, but hold on. But you're saying, does the job cause the divorce, or do you take divorce? Is it a lot of divorced people join? I thought you were saying that
People
job
get
causes
divorced because of the job.
Right. So in other words, you might be a fresh married guy. 10 years later, you're on your 3rd.
Yes, right.
Okay.
And that's kind of a joke. I mean, it's I'm not saying
it's
every single person.
But it's a joke because it happens a lot.
Right.
Right.
Alcoholism. That's PTSD. We have when there's an incident. Let's say there's a very horrific incident. We will have people come in and talk to us. We will have stress interventions, and they used to be called debriefings. Now they're called interventions. Where and sometimes it's like, you know what? We're gonna go help groom some horses, and that's gonna be your therapy.
Oh.
And we're just gonna go out.
Oh,
and-
so you'll get time off to do that.
yes.
Okay.
Yes.
If you go through something really bad.
A few years ago, we had a shooting at one of our local supermarkets at Tops Market. A man came in, totally racially driven. He came in and he murdered.
Shot like 7 or 10 people. Or
I don't
something?
remember the exact
Yeah.
number.
He was actually targeting them.
Yes.
It was like a video game for him. Right?
Yes.
He had his GoPro on.
He was targeting a specific race.
Right. Yeah.
And so people of different races, he would walk past them and say, I'm sorry, and then he would go and target.
Yeah. And did you get called?
I was on that scene. I was there.
And did you do the horse grooming after, or something like that?
No, I went and ate pizza.
Okay. Okay.
That's I told you before about gallows humor and how we deal with issues.
Of course. It's very
with
common.
stress eating
all
and
through
whatever,
time, all
Yeah.
over the world.
So on that scene, when I got on that scene, they still hadn't caught the shooter yet. So when I got on the scene, it was a hot zone. Like, we didn't know this guy's going to come back out and start shooting again. So I was in a high adrenaline situation. This guy could come out of nowhere and start shooting. We didn't know what was going to happen. The police hadn't fully secured the area yet. I mean, they did the best they could, but we had a staging area. We trained for these situations. We have a plan. And one of the people I was with ended up having to quit the job because they couldn't take it was too much for them.
It was the stress at that time, right? Because
yeah.
there was so much going on.
Yeah.
There was a possibility of getting shot at
Yep.
that time, and they resigned
Plus,
after that.
this is a Tops that I'd gone into on many occasions
Yeah, right.
to buy food.
Right.
This is a place where it's near one of our ambulance posts was. So there were many times when, we've been in there many times. What if we had been in there when this
Right.
happened?
Right.
What do you do? You can't do anything. You just stand there and let them walk past you. I mean, like, what are you going to do?
And what about the people that are new on the job? Is there a high turnover with them?
There is a high turnover. On average in EMS, and this is nationwide, 5 years is the magic number. If you make it past 5 years, you're likely to stay in EMS. But the majority of people in EMS are in for less than 5 years. It's
Okay.
high stress.
And is there situations that you've encountered where it's like just a few weeks,
I've seen one day,
One
the first day, where they're like, I can't do it.
even after being trained to do it?
Being trained is one thing. Actually
No,
doing it is
agreed,
another.
agreed. But there is training for this.
Oh, there's training.
You go to
So
undergraduate
to
or
be an
something, you get a
EMT,
degree?
it's a semester long course. To be an advanced, it's also a semester long course. To be a paramedic, you have to have been an EMT for a year. So you get a lot of on-the-job training. We have multiple certifications. Like as a paramedic, you have PALS, which is Pediatric Advanced Life Support. You have ACLS, which is Advanced Cardiac Life Support. You have PHTLS or ITLS, which is Pre-Hospital Trauma Life Support. You have, and then there's the paramedic training itself, and then we have to keep what's called CMEs, Certified Continuing Medical Education. So we need a certain number of CME credits every year. So I have to go to seminars, I have to take classes, and then every 3 years I have to recertify as a paramedic. So it's training is constant. We have to read the studies. We have to keep up on the latest and the greatest. Things change all the time, and we have to be up to date on it. Every month we do little Quizlets that are mandatory to keep up to make sure you know your protocols and what to do.
Right, so you get a lot of training, ongoing training throughout your career. If you get past 5 years, you'll probably stick it out.
Yep.
And I got to ask, how's the pay?
I'm sure people would disagree with me, but the pay is, for a guy like me who's been doing it for a lot of years, I'm doing okay for myself.
Yeah.
But it's like a school teacher, right? The school teacher who's been doing it for 30 years is making six figures.
Right.
The school teacher who's just started, the school teacher who's been doing it for 10 years, is not making six figures.
So it depends on how long
So
you've been
I'm
at
doing
this game.
okay,
Yeah.
and as far as pay goes, and other guys with my seniority and have been doing it as long as I have are
But
doing
you
okay.
weren't, though.
But
'Cause
most
when you first
people,
started,
when I first started, it was
I
a different
remember we
scenario.
talked,
Yeah,
and you said it's really challenging
Yep.
at times, right?
Yep. It's a different.
So you
scenario.
got to have a love for it.
Yeah. And I'll tell you, everybody who goes into volunteer firefighting, everybody who goes into volunteer EMS, everybody who goes into even paid EMS, not one of us is doing it for the money. Mm-hmm. Not one of us.
Well, that's why I say that you're
Now
the love of
doctors,
the game.
there are people who go to medical school just because they think they're going to have a lot of money.
Right.
And there are doctors who are miserable and hate their life.
Right. But there's nobody that says, I want to be a paramedic because I want to be rich.
That's right. You
Right,
are
right.
not going to
Right,
happen.
but like you said, there's things you love about it, things you hate about it, but clearly the things you love about it keep you coming back
yeah.
for decades now.
It makes me feel alive.
I love it. That's a great way to end. Makes you feel alive. I love that. All right, let's wrap it.
Great job.
Thanks,
All right.
Dave.
You're welcome.